Hello, my name is JC Sinram and I'm going to be going over the equipment setup of IVs. So, intravenous access overview. So what we're going to be talking about in my presentation is what an IV is, the qualifications needed to administer IVs, why patients need IVs, the equipment needed, and what you can do with them, and what the benefit is for the patient, and setting up for an IV. So, what is an IV? An IV is short for intravenous. Needles, they're laser sharp, and by this they're cut very precisely at the factory because they're needed to be in order to access veins for a patient. The IVs that we're going to be going over are IVs with catheters. Catheters are the plastic sheaths that cover the IV needle. A lot of people don't know this, but when people are given IVs, the needle isn't the actual part that stays inside the person's vein. It's actually just a plastic covering, and it slides over the needle into the person's vein. So there's no metal that's going to be left inside of a person, and the needle is only used for just for initial puncture and a slight access for the catheter to go in. The qualifications needed. So in the state of Alaska, you're required to be at least an EMT2. And the skills used depend on the sponsorship from a certain department. So once you get certified as an EMT2 in the state of Alaska, you can't just go out, buy your own IV stuff and start poking people and saying, I'm qualified to do this. Technically you are qualified, but without the sponsorship from either a doctor or a department or a borough, just like the Fairbanks North Star Borough, there's no way you can legally go and administer IVs. So being certified just doesn't mean you can just go out and do whatever you want. Depending on different states, but generally the advanced EMT is required, and that's for the lower 48 or any other state, really. And it's a nationally recognized certification called NREMT, or Advanced NREMT, that you need to have in order to do IVs. The state of Alaska EMT2 will more than likely not transfer over to other states. So there are many different levels of EMTs in the United States, and different states have different standards, as well as different cities have different departments with different sets of rules on what you can do. So, why do patients need IVs? Well, the basis for administering most medications is through IV lines. ALS medications, or advanced life support, such as cardiac drugs like lidocaine and atropine, are administered through IV lines. There are many different ways that certain drugs can be used, but without the foundation of intravenous access, there's no way that we can properly treat a patient. So the IV is basically a tool that we use as EMT2s and above to treat beyond BLS care, or basic life support care. We're going to go over the equipment. So in this picture here we have 6 needles ranging from 14 gauge to 24 gauge. The smaller the number, the larger the needle. And these are all IV needles with catheters. The size of the needle depends on the use, and this depends on what kind of treatment you're giving to a patient or what the situation is. So this could be for a cardiac patient, so you need IV access for administration of drugs, fluids, or whatever. Or it could be a trauma patient. For high traumatic injuries, for people who are losing a lot of volume, or hypovolemia, you preferably want a large bore IV. So you go with an 18, 16, or 14, and usually 2 of them to administer as many fluids as you can, as much fluid as you can, to either raise the blood pressure or just keep a person alive. Tourniquet. So a tourniquet is used on the extremity in which you're looking for a vein. So for a person, most people, you can't really see the veins as well. Some people you can, depending on how fit you are. And women especially, it's really hard to see veins because it's just sometimes veins are deeper. The tourniquet is a useful tool for EMTs and medical professionals to use on the arm, and basically it cuts off the circulation for just a tiny bit, letting the blood kind of backflow and making the vein pop out more so we can see it easier. Alcohol wipes are used to clear and clean the site to which you're going to be accessing an IV. the reason that alcohol wipes is important, or iodine wipes, whichever you prefer, is to make sure, because you're going to be puncturing and you're opening up that person's body to outside hazards. And so we need to make sure that we keep it clean in order for us to access an IV. Tegaderm. Tegaderm is a general term. There are many different ways and different tools that medical professionals use in order to secure an IV. Tegaderm is basically anything that has like a sticky, almost tape-like substance that goes over the IV catheter once you've established an IV to keep it secure, to make sure a patient doesn't just rip it out accidentally, or if it falls out or gets pushed out. Saline lock and flush. So this is basically a small little hose, if you will, that attaches to the catheter, and the saline flush is to flush out any air. And the main purpose of the lock is to make sure that you have an IV established, you're not backflowing any blood, and it's an easy way to administer medication. And tape, you need tape just because you want to either secure the line, you have an IV line coming from a bag, and you want everything secured. You don't want anything falling out. So we're going over some pictures of the equipment. So these are just some alcohol wipes. This is the saline flush I was talking about. This is what the saline lock comes in. It's in the package. And together with these two, make your saline lock and flush. And this is what attaches to the IV catheter. Here we have a tourniquet, some tape. So, what can we do with IVs, and what is the benefit for the patient? So, IVs are used with a multitude of treatments. Like I said, IVs are a foundation for which we build our treatments upon for patients beyond BLS care, basic life support. So, fluid resuscitation. I mentioned earlier traumatic injuries. Someone's in a vehicle crash, or they roll their ATV, they even fall off a bike, they break an arm or something, or if they're, they have an open fracture and they're losing a lot of blood. Hypovolemia is low blood volume, and we can treat that with IV fluids or normal saline. So that's where an IV would come in handy. Hyperglycemia, or high blood sugar, again, more fluids would help with the high blood sugar. Administration of medications. So, like I stated before, the basis and the foundation for IVs and the treatment of ALS care, advanced life support care, is our ability to give medications to patients. Some medications you can give through different routes, such as IO or an IM, and I'll go over that later in another presentation. Here's just an example of some medication that we can give intravenously. It would be morphine, fentanyl, and Valium. So, setting up for an IV. I want to go over preparing your equipment. So again, tourniquet, you gather all the equipment listed here, you gather it before you even make a move towards the patient. So, and before you gather the equipment, you have to make the deciding factor of, does this patient need an IV? Am I going to be am I going to be able to establish an IV? And once I establish an IV, what am I going to do? So, again, preparing your equipment, you need a tourniquet, so to make sure that you can be able to see the veins. An alcohol prep pad, to make sure that once you see the vein, you have the tourniquet applied, you can clean the site to where you're going to access an IV. The lock and flush. This is important, and a lot of brand new EMT2s will forget to set up their equipment, and once they'll have the IV, they'll have to hold what we call tamponade. So again, once you put an IV catheter in, now that is an open hole going from inside their body out, and you can actually, you won't bleed anybody out unless you let them sit there for 10-15 minutes with an IV catheter, but blood will come out, so they have to hold tamponade, which is like a manual tourniquet on that vein to make sure the blood doesn't come out. So the reason you have a lock and flush ready is as soon as you get that IV, you hold tamponade just for a little bit, and you're able to attach that lock and flush to make sure that you're not letting blood go everywhere just in the patient. And it makes you look really unprofessional when you have blood everywhere. The IV needle and catheter, you want to get that ready, have it set out, opened, as soon as you're able to see the IV, once you've cleaned the site, or the vein, sorry, once you've cleaned the vein site, that you have that needle ready to go. The IV tubing and saline, I didn't show a picture of it, but I'm sure most people know what a saline bag looks like with some tubing coming down. The next thing is preparing the patient for an IV. You have to explain the procedure to the patient. And you have to let them know that it's going to hurt. You're going to be poking them with the needle. Thank you for for being an audience in my presentation. The next presentation I'll be covering actually giving an IV. So I'll be showing pictures of an IV being administered, different IV sites, AC, which is your antecubital, your jugular, forearm veins, etc., and the administration of fluids or medications. So the amounts of medications, types of medications, and how to draw medications in different syringes. Thank you.